Diabetes is a growing health problem here in Malaysia, with a prevalence rate of 17.5 Malaysians, or roughly 3.5 million, being diagnosed with type 2 diabetes. And as you know, this year, World Diabetes Day falls on November the 14th, with the aim universally to raise awareness on this disease and how people can be in charge of managing it. Now, this year's theme, interestingly enough, is on women and diabetes. Now, the primary focus of this year's theme, apart from women and diabetes, is also to focus on gestational diabetes, an area that is quite unique because it happens to women while they are pregnant. And in today's roundtable discussion, I have with me a very esteemed panelist of professionals, and I'd like to introduce you to them. First and foremost, I have Dr. Nurayan binti Muhammad Noor. She's the Secretary of the Malaysian Endocrine and Metabolic Society, MEMS, and she's also a consultant endocrinologist at Hospital Putrajaya with over 14 years of experience. Dr. Nurayan is also the chairperson of the development group for the Clinical Practice Guidelines in the Management of Diabetes and Pregnancy, which is due to be released next year. With us today as well is Dr. Faisal Mustafa. Now, Dr. Faisal is a consultant public health physician and head of the non-communicable diseases sector, the Disease Control Division of the Ministry of Health in Putrajaya. He's currently engaged in the prevention and control of NCDs with special focus on diabetes and cardiovascular diseases. His main roles include policy and program development and strategic implementation of interventions for the prevention and control of NCDs in Malaysia. His most recent work is the development of the National Strategic Plan for Non-Communicable Diseases 2016 to 2025. He's a strong advocate for hard policies in creating a health-promoting living environment in Malaysia to reduce the risk of NCDs among Malaysians. And last but not least, we have Ms. Sebnam Tuna. Ms. Sebnam Tuna is the Corporate Vice President, the Business Area Oceania Southeast Asia of Novo Nordisk. Now, Novo Nordisk is a global healthcare company with more than 90 years of innovation and leadership in diabetes care. Now, Sebnam has a medical background. She holds a medical doctor's degree from the Medical Faculty of Istanbul University from her home country of Turkey. And I am Indra Balaratnam, consultant dietitian, and I will be your moderator and facilitator in this roundtable discussion today. So, welcome everyone. And thank you for taking the time to come here to talk about a very important health issue here in Malaysia. Thank you very much. So Dr. Nurayan, let's begin with you. Can you tell us now, why is women and diabetes an important topic to address?
Yeah, it is definitely an important topic because, you know, as we all know, the prevalence of diabetes in 2015 has gone up to 17.5%.
Yes.
And if we see at the prevalence of diabetes among women, it's actually about 18.6%, and it's a bit higher than the males.
Oh.
But another concern, I think, diabetes and women is having diabetes during the reproductive age group. I think as what you mentioned just now, having diabetes during pregnancy, as we always say, is gestational diabetes mellitus. So that is a concern, and it's a very important topic that I think the public should know, that diabetes and women is important, and especially to the younger ladies, they should be aware of this term of diabetes in pregnancy, and should see whether they have risk factors for all this for this condition.
Correct, correct. Now, what are some of the side effects of a pregnant woman having diabetes during that time?
The side effects will be the mother and also the babies. Of course, for the mother, they have higher risk of hypertension. They also have higher risk of having bleeding after delivery. And they also have high chance of having cesarean section.
Okay.
And for the babies, as we know, probably most of us know, is they have higher risk of big babies, and that can cause problems with labor. And the risk of also having congenital abnormalities, abnormal babies. So these are important, the complications to the mother and the babies, and we need to make sure that the public knows about the complications.
I think that's very important. Now, Dr. Faisal, why do you think in particular diabetes is important to women?
As you have rightly pointed out, the prevalence, the number of Malaysians diagnosed and getting diabetes is increasing over the years. The survey that Dr. Narain referred to earlier is the National Health and Morbidity Survey. It is a population-based survey that we conduct every 4 years. So the last one was in 2015, the next one will be in 2019. In addition to the increasing prevalence of diabetes, we are seeing the increase among all age groups. Malaysians is in aging population, correct?
Okay.
Malaysians are living longer, and age is a risk factor for getting diabetes.
So, but it's no longer that you need to be old or elderly to have diabetes.
Right. So we see more and more diabetes among the younger age groups. So the gestational diabetes is one issue which is specific to pregnancy. However, as our population with diabetes is getting younger, they are getting diabetes at a reproductive age, and that brings about a different set of problems in terms of health as compared to a lady with GDM, the gestational diabetes. There is the realization that what we call pre-pregnancy counseling or pre-pregnancy care becomes more important for these ladies. That means they have to plan to get pregnant. It's not a matter of, oh, my urine pregnancy test becomes positive, then I'll do something about it.
Right. So
for these ladies,
there's some pre-planning. So if there's an awareness that you're already going to start a family and wanting to get pregnant,
you need to get your basically diabetes well under control, on the right medication. So there are several things that you need to be aware of for you to go on your pregnancy journey, as you call.
Correct. Now, what's the, like you mentioned, there were complications in GDM and things like that. Now, what are the causes? Are there any causes to why a woman would end up with GDM?
Of course, there are risk factors for women to get GDM, diabetes in pregnancy. By increasing age, if they are increasing age by the age of more than 35 years old, they have higher risk of gestational diabetes mellitus.
A later pregnancy,
which and also with a later age.
I see.
Of course, if you have family history of type 2 diabetes, you have higher risk of having diabetes, gestational diabetes mellitus. And in those patients who have already have GDM in the previous pregnancy, they have higher risk of getting another GDM in subsequent pregnancies.
Oh, okay.
They actually have studies have shown they even have about 30 to 80% of risk of having GDM in the subsequent pregnancies, and that depends on the prevalence of diabetes in each country. And of course, if they have history of having abnormal babies, they also have to be screened basically for the possible gestational diabetes mellitus.
When you say abnormal babies, meaning?
Abnormal when they have congenital abnormalities, such as they have abnormal heart, valvular defect.
Okay.
So from my experience, I have done 3 times this way of, it's oral glucose tolerance test, where a pregnant lady is asked to take a cup of glucose drink, and they're supposed to have a blood test after that, 2 hours after that, and this is how we diagnose gestational diabetes mellitus.
So technically, any woman who's already pregnant who comes to the Klinik Kesihatan or to a healthcare facility, it's a standard screening for her to take that oral glucose test. Okay.
And it's
so she takes that, and then
lousy. I mean, it's very sweet.
Oh yes,
but that is the way on how we diagnose gestational diabetes mellitus. It's a standard way.
It's a standard way.
It's not just us. It's most of us in the whole world
in pregnancy. So then once the test is done, and if it comes out negative, then fine, she just goes on. But what happens if there's an issue?
If it is negative and that is very early in pregnancy, if you still have high risk, then we usually will repeat that again towards the second trimester.
Okay.
If the risk is less, then we just say you are negative, you are free from gestational diabetes mellitus. But once they are diagnosed, then we will treat them. The treatment either will be diet only, means that they usually will not, if they can be controlled only by diet, they can just be on diet, but they need to monitor their blood glucose.
Okay.
But another treatment will be insulin.
Okay.
They have to be on insulin treatment, and that depends on the blood glucose profile.
Okay. So that adds on another complication, right?
Yeah.
To it.
Yeah.
But like Dr. Faisal, we all know pregnant mothers go for the screening for GDM. But from what I understand as well, a lot of the managing of GDM and diabetes is also compliance. Now we know that, right? Like a doctor can tell them to take care of your diet, but then what are your thoughts on that in terms of compliance?
Let's just stick to GDM for the time being. The ministry have produced very clear guidelines and standard operating procedures, SOPs, on who the pregnant women that needs to be screened, at what frequency, and in terms of the management, there are already clear guidelines. One thing that has not been touched is that ladies with GDM, usually their blood sugar will go back to normal after delivery. However, we know they are at increased risk later on to develop type 2 diabetes.
Correct.
As they grow older. And in addition to the message that we want to get out, that pregnant women should get themselves screened for GDM, looking at the increasing incidence of GDM in the country, we would like also to emphasize the need for regular follow-up post-delivery immediately to recheck their blood sugar, and henceforth at least once a year. And that applies not just for pregnant women, actually. I mean, for the general population as well.
Correct.
Especially for GDM, because we do know that they are at high risk of getting diabetes as they grow older.
Right.
So, although there is a system in place, however, it is the responsibility back to the individual to ensure that they do undergo medical screening, health screening.
Health screening, and also to comply with whatever information. But now that part, I think, where diabetes is concerned, can be rather challenging. More so, I guess, in women, because sometimes women, they take care of everyone else in the family, everyone else's needs, but when it comes to their own management of their own health concerns, they tend to put it in the back burner. Do you all agree with me on that statement?
I agree. 100%.
Well, but that's a very specific health-seeking behavior that we're talking about here, getting yourself screened, even for basic NCD risk factors. And by that I mean your BMI, your blood pressure, your blood sugar. We do know for a fact that when SOCSO gave health screening vouchers, started 3 years ago, to all of the contributors of SOCSO upon reaching the age of 40, so it's just a one-off voucher. Up till now, only 20% of their contributors have used the voucher.
Seriously, that low?
So it is not simply an issue about awareness, about accessibility, about availability. These vouchers meant that you can get yourself screened for free, because it includes pap smear screening for certain for ladies. It can be done at the SOCSO GP panels, which is almost everywhere.
It's available.
And you're not stuck to the 9 to 5 MOH health facilities, office hours. And I re-emphasize again, it's free. So yet only 1 in 5 of the contributors have used their voucher. So they have not really looked at to the reasons why Malaysians are not getting themselves screened, and I'm just referring to a very specific health-seeking behavior, screening.
Screening.
And
that's the first line of action if you think about it, isn't it?
Even when the facility is provided, and even in any MOH clinics or hospitals, there are self-screening corners. You can go to a lot of pharmacies. You can get your blood pressure checked for free. You pay a nominal fee to get your blood sugar checked. It will be the finger prick check. There's plenty of health camps or public events where these are available, but yet we know anecdotally, unfortunately, that those with the highest risk are not the ones who are getting themselves screened. The people who are getting themselves screened are those at low risk. But I mean, they're very concerned about their health. That's why they go check, or they're already diabetic and they just want to check their blood sugar.
Correct. Just coming.
So we do know that, and understanding that behavior will be the first question that we need to ask, because I believe it's not just simply a matter of don't know or not aware.
Yeah. But in your heart of hearts, as also practicing doctors and also dealing with this issue and seeing the profile of the people that have or are at risk for this behavior, what do you think is holding them back? More so like in women, because what do you think is holding them back from wanting to?
I can say for the men.
Okay.
My experience is, to put it simply, ignorance is bliss. I don't want to know. If I know, I have to change my lifestyle.
And they feel that's too difficult.
Yeah, so that's too difficult. And the other thing is that if I'm fated to get that disease, then I'm fated to get it no matter what I do. It's a wrong interpretation actually of the Malay word, which is called takdir. It's not the correct word, right? Because you have to make an effort.
Yeah.
So, and my experience is that the men are worse when it comes to screening behavior. And we see differences in ethnicity groups as well. The Chinese are more likely to get themselves screened, the Malay less so. But I do not know about women.
But
so
I agree with you that women will usually put themselves the last person. So they usually will take care of the family first. For example, when they were asked to come 6 weeks after delivery, they will say that they will still be in their kampung. They will say that the priority is the baby. So I think most of them will usually look into a scenario that I will make sure that my family is okay first before I settle myself. So I can see that, for example, few of the ladies, when I ask them, why don't you monitor your blood glucose? Why don't you do this? Why don't you exercise?
Yes.
I don't have time, doctor.
I've heard that before.
I have to, when I come back from work, I have to cook. I have to take care of my children. I have a 1-year-old baby. So I told her, why do you just ask your husband to take care of her for half an hour? No, cannot. No, you have to. I said, this is your priority. Exercise is your priority. You need to do. Then you have to on and off be a bit selfish. I said, then you just do exercise and ask your husband or anybody at home to take care of your baby for a while. So that is the nature of being a woman. Of course, we have the feeling that sometimes certain women just cannot avoid. But on and off, I'm telling them, try to be a bit selfish. And it's actually not, it is actually for you. And for you, and it will make the whole family feels happy with you being healthy.
Now, Sebnam, I noticed you were nodding your head when Dr. Narayan mentioned that. What are your thoughts on women and diabetes in that sense? Do you think they tend to put themselves last when it comes to...
Yeah, I think it's an important topic to comment on. You know, in general, it may be generally taught like this, maybe in a different cultural setting, but also from my home country, I think women are more responsible to take care of both internal the house, as well as if they are working also to make sure everything is in nice order, and so they become more busy maybe from that aspect. But when it comes to the diabetes treatment and the woman for that, I do see there is a huge responsibility on the woman, because not only from a gestational diabetes perspective that they should be aware of taking the blood glucose levels and check and get diagnosed about it, but on the other hand they are so much responsible of making the care of the nutrition and the diet of the family, where of course it needs to be going to the healthy nutrition lifestyle so that it can be either prevented or again healthy babies are going to get born. So from that perspective, I think women are super important.
Correct. All the more so, right? Because they are the ones who carry that baby to pregnancy. So the implication of the health also then affects the offspring.
So related to that, that I can maybe connect to that, the young couples who are planning to get babies and the pregnancies, it's also important to know what could be the risk factors of the gestational diabetes, and to be able to have a healthy pregnancy as well as a healthy baby. What are the needs to develop? And there has been a very nice project that's been run together with Ministry of Health of Malaysia and Novo Nordisk partnership with other international partners like University of Southampton from United Kingdom, and University from South Africa, as well as Estino Diabetes Center from Denmark, which is called Jom Mama. So in Malaysian, I heard that it is "Come on, Mama." So meaning I want to get to the earth as healthy as possible. So take action about me. And the whole idea was to train the young couples about how to become a healthy pregnancy life, and what are the things that they need to do, both from a nutrition as well as taking their health care, having their glucose levels or the health check done, as well as be aware of the gestational diabetes.
Also, they're learning things to help them to prevent diabetes,
as well as preventing the diabetes.
I see.
It was a kind of interventional trial that you may say, which around 500 couples in the territory of Seremban that's been put on this trial, and now it's finished. So it is kind of a control group which are being trained and followed and make sure that they are good on diet and exercise and lifestyle and all kind of stuff, together with the help of the community health givers, the nurses in that territory, and the control group just, let it go into the normal life and how it seems. So the statistics is going to be done now, and next year by March we will know the control group as well as the treated group, you may say, and we will see the difference. I think we can agree that still the treatment, putting focus and follow-up is somehow going to have an impact, most probably.
So that's interesting, taking the stand of prevention. Now, is there anything like that that's also done at ministry level?
Well, actually, this is a collaborative effort. We want to look at intervention at the earlier part of your life course.
So not after they've already had diabetes, but starting from young.
Life course. Because I think sometimes we like to look at it, well, the public sometimes sees that, oh, I got diabetes because I didn't take care of my food, or I got diabetes, because I eat a lot of sweet food.
Yes, correct.
Right? And we're trying to explain that the process of getting diabetes is an exposure to the unhealthy food, physical inactivity, unhealthy lifestyle, even from a young age.
Correct.
There is evidence, in fact, that even as a fetus, the lifestyle habits of the pregnant mother already impacts on the fetus's risk of developing NCD, diabetes, cardiovascular disease, when they are older. So it is not simply a disease of poor choice. Right? The fetus didn't have a choice. When the baby is born, that baby didn't get a choice whether he's fully breastfed or not. During the weaning process, the baby or the infant didn't get a choice of what kind of food is introduced. Right? So you accumulate your risk throughout your life. We're hoping that through intervention among young couples, sometimes you need a reason why you want to change. Right? We can change behavior, but usually, like stop smoking or trying to lose weight. Usually there is a trigger, right? A reason.
Yes.
We need a reason. And we're hoping that planning to get pregnant is a reason. Yes, I'm trying to get pregnant. Maybe that's the time I want to stop smoking. And it is not just the woman; it's the man and the woman.
Right.
A couple.
Right.
So maybe we're hoping that would be the impetus. Because prior to running that intervention, we also looked at the situation of young couples. What are their priorities? And it wasn't surprising to see that health is rated very low.
Oh dear.
In terms of
all the issues they have to look at.
Life priorities, understandably so, especially with the current economic climate of Malaysia. And maybe that's the other explanation as to why VA Malaysians are not getting themselves screened. Maybe the risk perception, the priority setting when it comes to health is very low.
Right.
I'm still young.
Yeah.
I feel well. It's not going to happen to me.
Yeah.
I'll get myself screened when I reach whatever age. So going back to the earlier point, it is something that we look forward to the results because definitely it is trying to address the issue about the increasing prevalence of NCD, looking at what other ways that we can do to improve the situation, to get Malaysians to be, well, I use the word to take ownership of their health.
Right, that's right. Dr. Ryan, what are your thoughts on this? Do you think taking the route of prevention, creating that awareness would be of any help?
I agree with Dr. Faisal, and I'm so glad that you come into the picture and get this project done. It's a very good way of sort of educating this couple on how to prevent, to make a healthy lifestyle before they get married. And currently it's quite difficult, like what Dr. Faisal said, the priorities are not there. I mean, it's not just looking at the couple, younger couples. If you look at the current patients that we have, even when we ask them, why don't you buy a glucometer, this machine that you check your blood glucose, they would not buy sometimes because they don't think that is a priority. They would rather spend their money on other things. So what is important for us medical providers is to emphasize what will be your priorities. Make sure they get their priorities right to make sure that they have good control of diabetes. But at our level, because I'm in the hospital, I mean, of course we are seeing patients, but I'm sure that if we can prevent this from happening, it's better. So I have less job.
Correct, correct. So in this intervention, Sabnam, what all is being taught to them as a couple?
Yeah, it was more first train the trainer, meaning the nurse trainings and the community health providers trainings.
So you use the health clinic where the couples would come for their checkup.
Get the advice.
So the nurses become the
Yes, and about the nutrition, the dietitian, and there has been an e-health platform that has been developed. So it was kind of an application that the young couple can download to their smartphones and continue to
like an app. You mean?
Yeah.
Okay.
And which gives some sort of alerts to them, what to exercise, what to eat, what is the healthy food look like, and what is the healthy life in general look like, and getting ready to get into the pregnancy. And when the pregnancy also happens, when to check the blood glucose level with these tests that has been mentioned before. So this was the general training activity that's been giving. So it's a more awareness and education to the young couples how to become a healthy family together with the healthy baby. Because we know again from the gestational diabetes that the baby that's coming to the earth can have a diabetes in the future. So again, it goes back to how can we prevent this global burden. You mentioned that around 3.5 million people in Malaysia is living with that disease. But if you look into the globe, which is a huge burden, in terms of type 2 diabetes, we are talking about there is around 400 million diabetic patients living today, and it will be around more than 600 million patients we are talking by 2030, according to International Diabetes Federation numbers as well as WHO. So it is a big epidemic and a slow motion epidemic that we are talking. So anything that you can do to prevent it or to stop it to happen is gonna. So it's a public health issue that every partner, stakeholder, really should put effort for it.
Yeah. But interesting that now a lot of people are looking towards prevention. But do you think our young Malaysians are open to wanting to know more? Especially now with the use of apps, I can see you're making an effort to try to make it more
E-platforms.
now, you know, like something that they would relate to rather than just giving them papers and go home and read. You know, chances are they'll take it and just throw it away. But Dr. Faisal, what are your thoughts? I mean, being that you work
you
at
talk
Ministry
about
of-
technology slightly, which reminded me of a survey which was conducted by the Malaysian Commission for Malaysian Communication and Multimedia Commission, MCMC, 2016. So what are the main sources of information for Malaysians?
Correct.
So the main sources of information for Malaysians, number one is instant messaging, basically our WhatsApp,
Okay.
WhatsApp groups. And secondly is Facebook. Twitter is very high in a lot of countries, but not in Malaysia.
Not in
In Malaysia,
Malaysia.
Twitter is number 5 or number 6. So I think, and any healthcare provider will tell you patients will Google up first,
The Dr.
Before-
Google syndrome, yes, we've heard that. Yeah.
right?
Or they're
And
looking
there's
for
a lot of
information.
misperceptions about diseases and management and treatment and cure coming from the WhatsApp groups, social media, and also from the social media and WhatsApp. So therefore, I think we need to move with the times as well.
Correct.
Looking at how we can utilize technology in engaging our clients. Maybe clients will be a better word. Even the young couples that is involved with the Jom Mama project, they are well. And in fact, they would usually not even have come to a healthcare facility. And the way that we are, they are recruiting them is initially not through clinics, but you know, in marriage registration
Yes.
offices, when they come for the compulsory screening for Muslim couples. So we need to again look at other ways of reaching out, look at other methods of raising awareness and knowledge, because apparently maybe patients or people do not listen to doctors so much
Correct.
in those days,
Yeah.
professionals, and they tend more to believe what they get from their friends through instant messaging or even social media.
Or not to say that they don't want to listen to the doctor, but maybe as healthcare professionals, we may need to relook how we are communicating to the client per se. You know, maybe when they come to that hospital setting, the minds are shut off. There's a certain something that triggers that behavior to not want to listen. But maybe in another state or another form, it might be different. Yeah.
Yeah.
There is that other study, right? The Dawn and the Dawn
Yeah.
2 studies,
Oh,
which shows
tell us
that
about that, yeah.
that what the concerns of healthcare providers is actually not in line with what the patients, and this is looking at the diabetes patients specifically, so that the concerns don't match what the patients is concerned about, worried about the disease is different from what the healthcare provider.
Oh, can you tell us more about
So
that? In what way does it not?
There
match?
is that mismatch.
Okay.
Okay.
So what
Maybe
is the
for the
patient
doctors
looking at?
are worried about glycemic control, reducing complications,
Trying to get your numbers down, the reading to be.
but yet the patients are for them is their quality of life, which for them sometimes they don't relate directly to
The disease.
to the disease. So can I still eat what I like to eat? I mean, I'm sure you have had
Yes.
that
And I think a
experience
lot of
being a
them
dietitian.
not wanting to change the food. Yeah, can I still eat it?
Can I still do the things that I usually do, whatever that may be? And we as healthcare providers sometimes do not really engage the patient in the manner that addresses their concerns. I think this is just simple human psychology,
Yeah.
right? If you feel that the person that you are seeking help from is not really listening to you,
Yeah.
or if you feel that the agenda is not in line, then you are less likely to adhere, to follow
Yeah.
the advice. And I think that is a challenge for healthcare providers as well. How can we teach? How can we educate our doctors, nurses, and the other categories of healthcare providers to engage our patients more effectively, because we are talking about a chronic disease here, as opposed to acute condition like cough and cold, where it is a one-way conversation.
Yes.
A chronic disease, the conversation needs to happen both ways. The patient need to be actively involved with the disease management. It is not something that can easily be, the patient can just easily give that responsibility away to the healthcare provider. Okay, doctor, just tell me what I need to do and I'll just do it.
Exactly,
It doesn't happen that way.
Correct. Because as we know, 90% of the work has and the compliance has to come from the patient themselves.
I think the word engage, patient engagement is very important.
Yeah.
You know, I used to say to patients, why don't you go back and do this. You know, I realize it's a failure. You know, it's important in a consultation to get the patient engaged. You know, when the patient has poorly control of diabetes, I will sit down with the patient and look at their eyes and say, come, let's discuss. What should we do?
Yep.
It cannot be what I want you to do. You must follow what I say. It has to be what should we do. So in that consultation, you know, it's very important to make sure that what they like, what they dislike. You know, there's one good example. I was always telling my junior doctors on how we talk to patients. You know, this one lady who was about 60 years old lady who has type 2 diabetes, who came to my clinic crying.
Oh dear.
Because she was told that she cannot eat rice. And she said that I can allow to only eat bread. And she said in Malay, I know, saya orang Melayu, I'm a Malay person, so I cannot just eat bread. I have to eat rice. So it's important, you know, for us to get to know the patient's culture. You know, you cannot just ask the makcik, a 60-year-old makcik who has been eating rice for the rest of her life, to just change and take bread. So the patient engagement is very important, and to know what are the things that prevent them from making themselves better. That should be the approach rather than instruction. Yes, you do this. You follow what I say.
Correct.
So I would say that if there is a discussion and engagement and a way, you probably need to facilitate. They will volunteer the answers, how to improve themselves. You should not give the answers. They should be providing the answers. And if you facilitate that, make a very fruitful discussion and hope that the patient will follow this instruction, not instruction, some ways to make them better.
Some points that you would have been communicating. And in that retrospect, does MEMS play any role? Does your association help to train doctors in that sense?
Yes, we do. We are a society, a metabolic endocrine society, that we usually will be having partnership with certain certain companies, such as Novo is one of them, that we train medical providers, not just the doctors, the paramedics, and we also involved in a bit of public awareness.
Yes.
Of course, our concern is mainly on education to the medical providers, but we also will support Diabetes Day celebration.
Yes.
We have been supporting every year, and we also support few of our members who wish to do this World Diabetes Day celebration at the institution, and we are very happy to do that.
Yeah, correct.
We hope that the objective of the celebration of the World Diabetes Day will be achieved.
Correct, and that's what your organization also stands for, the fact that there's an awareness, not just from the public or the person having the diabetes, but also the people who are helping to manage them. And I rightfully said. Now I understand that for World Diabetes Day, you will be having a program that's being done. Can you tell me more about that? What you all have planned?
In Hospital Putrajaya, we are going to have this program in Alamanda, and that will be on the 18th of November.
Okay, what time?
That will be the whole day until 6, and there will be basically health screening. Our objective is to increase the public awareness of diabetes itself, and by the team of Diabetes and Women for this year. And we hope we can, by doing health screening, maybe we can identify those who are actually diabetes, and we have ways how to refer them. But this is basically to increase the public awareness.
Yes.
And we hope that on Saturday there will be a lot of people in Alamanda, so we can capture as many as possible.
Correct. Will there be other activities as well besides screening?
Screening and a bit of exercise.
Okay, all right, all right.
That small area, but I think should be okay.
I think, yeah. Can they find out more information about it through your website, or?
Unfortunately, we don't have a website, but I would encourage everybody to come on that day, especially those who are staying nearby Putrajaya.
Okay.
It's quite easy.
Right.
In Putrajaya, there's only one shopping mall
Yeah,
beside
I'm sure
That's
they
technically outside of Putrajaya.
yeah,
I think more
so
shopping
you
malls
should
Malaysians will know how to
try
find
to
it
go to
there.
Alamanda on the 18th.
Right. Correct. So, well, thank you so much for all your insights on everything. But just some last parting words. Sabnam, what about you?
Yeah, what I
Coming from an industry standpoint.
Yeah, I think it has been very nicely put forward that the numbers are big in terms of the burden, and of course it becomes kind of a public health issue for every nation, including Malaysia. So as an industry, what we are trying to do is trying to be a partner with the stakeholders to how to tackle this burden of public health issue. And one of the things that we may add value is the training programs, either to the healthcare professionals or to the public, increasing the awareness. But the second thing, there has been a lot of discussion about, it's a normal life, it's a chronic condition, and people do have their normal life that they would like to eat the rice still, would like to go to the school or their work life. So with the research and development activities in our side, we are trying to get most innovative products that this is going to fit to their daily life, much more compliant, both, increase the compliance for both the patient's life, but it's going to help also for the healthcare providers.
Yeah.
Because at the end of the day, it is the normal life that those patients are also deserve to live.
Right.
And of course, it comes with a kind of economic burden to the public because the numbers are big. But we also say treating diabetes is not expensive, but not treating diabetes is very expensive, because it goes with some sort of complications, either with the eye or kidney or heart or foot. So those complications becomes really big burden again to the public, but as well as the individuals and the caregivers in the family. So it needs to be either prevented early, or if it comes, it needs to be diagnosed and treated, and get into the management of diabetes. So whatever we can help in that prospect, we are trying to put our efforts forward.
Yes, exactly, because as we know, it's a partnership. It's a working partnership.
Exactly. And the international studies actually show that when you look into the cost of the disease, the diabetes, it's only 7% used for the products or the drugs. The rest, 93%, goes either for the cost of the complications or the other costs, the inefficiencies of the people, or the stuff that really causing because of diabetes. So it's so important that the people are going to be aware of the risk factors and get diagnosed and put on the treatment on time, and on the right treatment. Right.
And I think that also comes from that openness, wanting to trust their healthcare providers, so that they're open to wanting to be educated on it, or also to manage it. Yeah. Dr. Faisal, what are your parting thoughts, especially to women out there?
Well, if I just may follow up from what Sabnam said just now, you talk about the direct costs. What we almost always forget is the indirect costs. You are off work. As diabetes is getting younger, that means you are supporting your family. I mean, you are in the economically productive age. You're off work, you're on sick, so you're the main breadwinner. That's from the family's perspective. From the employer perspective, you will get a working population which is less productive because they are off work and not
Yeah.
as productive as they should be if they are fully healthy.
Mm-hmm.
And you get that translated to a reduced productivity for the country as well. And I think the way that diabetes is going up and the way that they are getting younger and younger and the way that their risk of complications is quite high as well, some of them listed Mazhabnam as well, you know, your heart attacks and strokes, which is the main causes of death in Malaysia anyway, and they're getting younger and younger. So that will have negative economic consequences for the country. And of course women would bear the brunt of it. And people don't usually relate, you know, heart disease, heart attack, stroke with women, usually with men.
Yeah.
But diabetes just increases the risk for women.
So a diabetic woman is more at risk for all
much
that.
more at risk for getting heart attacks and stroke. So it won't be surprising as we progress over the years that the prevalence would increase as expected. So the costs, risk of complications, again adding to the costs, and among women as well. So I think we need to look at the disease from the economic perspective and not just from the health perspective.
All right. So those are your parting words to women with diabetes, that they are also at risk for a lot of other secondary complications as well as the cost. Now, your parting words, Dr. Narain.
I would like to advise all women to make sure that they know the risks of them having gestational diabetes mellitus. And if they have, they know, like what I mentioned just now, and if they know they are at risk, they have to be proactive and make sure that they be screened early. And I would also advise women to be making sure that they are also strong and make sure they are, despite taking care of their family, they still have to be the one responsible of their health. They cannot be making others to be responsible of their health. They have to be responsible of their health, make sure that they should be the priority to make sure the whole family is healthy.
Yeah, correct. To be more empowered, I guess, is what you're trying to say, right?
Yeah.
Yeah. And that would be a challenge. I think that's where us as women folks ourselves can help other women to be empowered to see it that way. Yeah.
Right.
All right. Well, I thank you so much to all of you for taking the
Thank
time
you.
out to come here today to talk about a very pertinent health issue. All right. So, and with that, this comes to the end of our roundtable discussion on a disease that's very important here to Malaysia, and that is diabetes. And in today's discussion, we focused on the World Diabetes Day theme, which is women and diabetes. And as we can see, the woman plays a very important role. And all the more, if you are a woman watching this roundtable discussion, or if you're a spouse or a family member, or you have a family member that has diabetes, please let them know that it is time to take care of themselves. And if you can, to be that support to them, to empower them to make changes. If you haven't had the disease, but you've got risk factors in your family, then it's time to know the ins and outs of how to prevent it. Or if you already have diabetes, then it's time to also manage it. I'm Indra Balaratnam, consultant dietitian, and I thank you so much for watching.